Toolbox talk number 21, which concerns leptospirosis or Weil's disease. So basically what it is, it's an infection that is carried in animals, particularly in the urine. So you can see here, source of infection is urine of infected animals, and particularly rodents, and indeed probably more so with rats. About 60% of rats carry the leptospirosis virus. So human infection is accidental. So aged children can acquire infection from dogs, which is more frequent. Occupational infection through veterinarians, slaughterhouse workers, farmers, sewer maintenance workers, waste disposal facility workers, and people who work in derelict buildings, rowers, kayakers, and canoeists also sometimes. So for us, really, when we are in buildings, and indeed any buildings that we are in, particularly if there's water sources and that water is lying stagnant, and then rats can get into that, urinate in it, and then the virus can grow in the stagnant water. So it's shed in the urine and can survive in soil for several weeks. Okay, so it's got a high level of environmental contamination where animals frequently urinate. And as you see there, poor housing is one example, limited places with limited water supply, and inadequate waste disposal. So how's it transmitted? So through direct contact. So if you have skin abrasions or intact mucous membrane, so again, if it goes in through your mouth or if it goes in through cuts, and then indirect broken skin with contaminated soil, water, or vegetation, or ingesting it through contaminated food or water. You can also have droplet infection, so breathing air polluted with droplets of urine, like while milking cattle. So unlikely that on a construction site you would get it through that medium. It has an incubation period of 7 to 12 days. And what you would get is sudden fever with chills, intense headache, severe myalgia, abdominal pain, conjunctival suffusion, I'm not sure what that is, and occasionally a skin rash. So the first phase is 3 to 7 days. So the disappearance of symptoms coincides with the appearance of antibodies and disappearance of bacteria in the bloodstream. 90% of cases are mild leptospirosis. There's lung infected as the most serious and life-threatening of all complications. Often incorrectly diagnosed due to non-specific symptoms. So it can be hard to actually diagnose what it is. And fatality rate of 5% of people who get it end up dying. So the clinical criteria, so this is the sort of things that you'll be asked, is a history of fever within the past 2 weeks and at least 2 of the following findings. So myalgia, headache, jaundice, conjunctival suffusion, don't know what that is, and I don't know what that is, or a rash, okay, or at least one of the following. Asphatic meningitis, abdominal nausea, vomiting, diarrhea, or pulmonary complications such as breathlessness or I don't know what that is either. And problems with your heart, so heart fluttering, racing heart rate. So again, really the treatment, if got quickly enough, is a lot of antibiotics, amoxicillin, ampicillin, and doxycycline. In some cases, some of those other 2 drugs which they can't produce or pronounce even, glucose and salt infusions, dialysis in several cases, and organ-specific care in some cases, such as your kidneys and liver and heart. So how to prevent it? Control the infection at source, so rodent control, animal vaccinations. So for us on site, it would be more like rodent control, so setting traps for rodents. We're trying to exclude them from certain areas. Wearing protective clothing. So again, for us, gloves, protective footwear, etc. and prevent infection or disease in the human host by vaccination, etc., which is unlikely for us because we wouldn't be classed on site as a high risk group. So the main protection for us would be PPE. And that is it. If you have any questions, speak to your supervisor.